Welcome to the Vatech weekly webinar series, May 13th edition, 2020. I am Jim Mayer, a Vatech Education Team Manager, broadcasting live here from St. Louis, Missouri. This happens to be our 7th broadcast in our Wednesday weekly webinar series. I'm always have the pleasure of coming to you with my coworker, Paul Satone. Welcome, Paul.
Hey, Jim, great to be back with you. Last week, we had a really great session with Dr. Dale Miles, focusing on CBC team anatomy. And this week, we've sort of shifted gears and are focusing a little more on getting back to the office. So, we're in a new time, or we're entering a new time here. So we wanted to ask ourselves, what does the dental practice look like moving forward? And, how we're going to best adapt to the current situation that we're in today. So.
Yeah, Paul, I'm really looking forward to today's session with Gary Kadi. What is this new paradigm shift, or what are our patients expecting once we get back to the office? So we'll bring Gary up here shortly, but let's go through some housekeeping things and get everybody set for the webinar. And what do we have coming up, Paul, within the next couple of weeks moving forward?
Yeah, so a few more good sessions for you. We have session number 8 on the 20th, next Wednesday. We're calling it the Guided Surgery Tour. Basically, it's going to be start to finish, taking you through the guided surgery workflow. We're going to be working with Implant Concierge for that, and that's going to be really looking forward to that one. May 27th, our 9th session, we're going to call it Presenting the Case, and we're going to sort of kind of put all the pieces together from, a little bit from each of these webinars, talking about image capture, data review, and consultation. And any feedback that maybe of interest, please let us know. And then so after this, we're kind of maybe going to focus in a little more on a smaller setting with these webinars. We'll probably still have these larger ones occasionally, but things like positioning for 2D and 3D. What's the differences? For the staff. Doctor, staff, beginner, immediate, advanced 3DI sessions, tips and tricks, things like that. So we're going to call that the Study Club series, and that's more information to follow on that. But again, any information, any suggestions, this is how you can get a hold of us. So any feedback, webinar feedback, it's going to be sales@vatechamerica.com. Any questions for our education team, software-wise, you can always reach us at education@vatechamerica.com. And then customer support, easy way to get a hold of them, cs@vatechamerica.com. Our website, of course, vatechamerica.com. And you can always reach out to us on Facebook, Instagram, on LinkedIn with the handle of Vatech America. So
awesome. Perfect. Thanks, Paul. Lastly, the navigating through what we're seeing on screen. You should see Paul and myself at the top of the screen. We're going to switch that over here shortly to Gary Kadi. You'll be able to see his screen for his presentation. Off to the right, you're going to see your go-to webinar control panel. If anyone's having audio issues and using the onboard computer audio, just click on help. It'll run you through a troubleshooting of your own computer. Or if that fails, or if you'd want to, just rather go ahead and phone into the session. You'll be able to hear everything. Just note everybody is muted, but this is going to be a question and answer session. We're going to have our team standing by throughout the presentation. You can always ask questions to the education team, and at the top of the hour, we're going to have a Q&A session. So today, May 13th, Complete Health Dentistry, a Paradigm Shift. We're all starting to get back to the office, or at least thinking about it. What is going to be our new patient? How are they going to relate to dentistry? How is overall oral health and dental health? And how are you going to position this in your practice? We talked about having a Q&A at the top of the hour after Gary Kadi's presentation. And I would like to go ahead and introduce Gary Kadi. He is the founder and CEO of Next Level Practice, author of $1 Million Dentistry. He's served the dental industry for the past 20 years. He's developed the Complete Health Dentistry business model to transform dental practices to focus on their patients' complete dental health. So I'd like to go ahead and introduce Gary Kadi. Let's bring him up here. And Gary, welcome.
Hi, Jim.
Hello.
Hi, Paul. Good to see you.
All right. We are well.
Good. Well, you guys are you clean up well. You look sharp today. And you're like Fallon and Timberlake. Like you guys are styling, and you're like the Fallon and Timberlake of the webinar world, man. You guys are awesome. So good to see you both. Thank you for your introduction. A real privilege and a pleasure. I also understand Lisa's coming in. Can we, as soon as Lisa gets on, can we bring Lisa in? Because I'd like to have her represented as well.
Perfectly. I'd like to go ahead and introduce Dr. Lisa McDonald. She's going to be one of, I guess, the guests for today. Dr. McDonald specializes in complete dental health dentistry and practices in University City, Missouri. She's been nominated as the top dentist in St. Louis from 2015 through 2019. Welcome, Dr. McDonald.
Hi, thanks. Thanks for having me. I'm excited to be here.
We are excited to have you there.
Yes, and can you see Jim? Welcome, Lisa. So excited. Lisa and I have grown up in dentistry together. I knew her when she started as an associate. Gosh, 12 years ago, Lisa, right? So yeah, so we're going to talk about and unpack what to do, what to do when we come back, what's working. Lisa's been back for 2 weeks now, so it's going to be a great session today, Paul and Jim, because we're going to actually bring reality to the situation. We're going to bring what to do, why to do it, and then Lisa's really going to talk about being as a dentist, going back inside the office now for 2 weeks and talk about what to do and how to do it. So it's a super, I'm so glad that we have Lisa with us today. She's really going to bring a lot of things to life.
Definitely. Gary, do you want us to bring you up on your video also?
Please, yes. Oh, I didn't realize that. I thought you got to see me in the epicenter of the world. I'm here in New York City today.
Oh, nice.
Yeah, if you bring me up on video, that'd be great, because I do get animated. I am half Italian, so I do get a little animated here, Jim. So, you know, I think it's going to be important. I'm going to talk with my hands. You know, we're going to do that kind of stuff.
Perfect. So we just sent a webcam request over there. You should get prompted to turn your webcam on over there. Or if you look on the right of your screen, you have the little webcam picture on the GoToWebinar. You can click on that, and that should launch your video.
I do. Let me see if I got that. Let's see if we get that right. It says webcam preferences. There it is.
It might be in the back of the screen.
Perfect.
We
All
good?
right. We are good. Well, I think at this point, Paul and I are going to close our webcams out. So Gary, you and Dr. McDonald can do your thing, and we will revisit at the top of the hour. Thank you both for joining us today.
Thank you, gentlemen.
Thank you.
All right, let's do it, Lisa. It's you and me. So I want to make sure that everybody can see. Do you see my screen, my PowerPoint, Lisa?
I do, yes.
Okay, great. I just want to make sure I have everything set. So, you know, as you know, and everyone that's listening today, the world has changed. And going back, you know, what I found, like, you know, when we're sitting on the sidelines and going back, it's been reported. I've talked to dentists in every region of the US today. I'm going to get my last dentist from Alaska today. And so I've had, like, everybody's starting at a different spot, right? The states have different regulations. Each state is opening up differently. Each county is opening up differently. And it's best described, I think it's important to be best described so everybody can rest and relax, to worse than the first day after dental school that you get the keys to your practice, because now all of a sudden you're going, well, you know, it's almost like being at your wedding day and you're going, which drunk uncle's going to show up, right? It's like, I thought that was funny, Lisa. Am I on a delay? Like, you're not going to laugh at my jokes today? Like, which drunk uncle's going to show up, and like, what are the patients going to think? And what, you know, my team is all over the place. You know, my hygienist, you know, we have to hand scale. They don't want to hand scale. So we're gonna really boil this thing down. I'm going to walk through it step by step. And you're going to be speaking from, because you were highly successful coming back, right? You came back to a full schedule, almost a full team. And then that was last week, and this week it's even better, right? You're even in a better spot.
Yeah, it's you know, I had some anxiety going into, but we kept, during the time we were seeing emergency patients, we kept in communication with our team, used the time to make our we had a couple C and D team members, and we decided, hey, let's find some A and B team members and get all of our team on the same page. And started last week, and we had a training, I know, with you and Nicole, our coach, and my team is at peace. They feel well protected. My patients are at peace. They feel well protected. I had several people email me. We had sent out a letter that one of your coaches, Gary, helped us come together with, and we edited it, of course, to our needs. But I had people email me, oh my gosh, you guys are doing so much to take care of us. Thank you so much. I can't wait to get back in. And we had a super successful week. Plus, the positive energy in my office with my team is awesome. I'm so grateful for that. I hear laughter in my break room. I've got people helping each other out, going to the next level to just take care of our team and our patients. And I'm happy to be back. I miss dentistry so much when I wasn't able to do it the way I wanted to.
Well, thanks for giving hope to people, because I think that that's where we have to begin. Like, there is hope. We are going to come back, because there's a lot of people sitting on the sidelines right now. So today, what we're going to talk about is the new patient, because the patient that you left is not going to be the patient who's going to be showing up, and how they relate to dentistry. And you can go one of two ways here. You've been working for 12 years to build something called complete health dentistry, and we're going to talk about what that is and how to move toward that, because that's really where the patient is. That's where the puck is going. That's where the Gretzky dentist is going to be. And so we're going to share about that, and then we're going to talk about that oral health is the gateway to overall health, and why that is so important now more than ever, and then how to utilize technology as the standard for care for complete health dentistry. And this is key, because if you're not using technology to have no or low touch dentistry, it's sort of like, Lisa, the best analogy, I lived through and worked practices through 9/11 downtown here in New York City. And no one before 9/11 would have said, I'm taking my shoes off, I'm taking my laptop out, all the new standards that were set. And right now, we can see all the new standards from the ADA guidelines that it's going to be lower no-touch dentistry. So moving to that is just where the puck's going to be, and we're going to unpack that. And then we're going to go over case studies. When you implement units like a CBT scanner, the impact that it has on treatment presented and treatment accepted, huge difference, as you know, because you're a user. And we're going to show facts, because there's nothing like evidence-based facts of using a Vatech unit specifically, because it's interesting. I work with almost all of our clients have CBT scanners, and there was this commonality. I'm like, why is this one better than this? And just Paul and Jim, for instance, the way they care about us and took care of us to get us here is the type of care that they have in the whole company. I know Brian, the CEO, and Lou, these guys treat you like family. It's not like they're dropping a piece of equipment in your place. Getting treated like family and getting everybody engaged is a difference maker, and you experience that, right? So we're going to really let's talk about that for a second, because I think it's really important that it's highlighted.
Yeah, it's definitely a big piece of equipment, and I had some fear going into it, thinking, am I going to be able to even use this thing? And am I going to be able to read this thing? It's just, how am I going to get my team trained? And Jim is amazing. Anytime I need him to, he comes by and looks at the film with me, or we look at the scan and make sure that I'm seeing or we're doing what we need to do. He comes in to train my team to make sure that they know what they're doing. And it's just, the support is awesome. It really makes it so much easier.
So we're gonna get to the case studies at the end. We're also going to give you a free snapshot. So I'm able to plug into your software and give you all the data that I'm going to show you today, customized to you. So you can have your spouse, you can have your CPA, you can have, we can sit down and really look at your practice and see all the many opportunities that exist in there. Take out your camera, because I'm going to share some things with you, some good scripting on how to language things to patients. So be ready to record, be ready to take pictures, because Lisa and I are going to unpack this thing. So let's strap in, tray tables up, and let's do it. All right, so This was sent to me, Lisa. This is our third year. We have a 3-year curriculum and then, an advanced curriculum after. And one of the team members sent this to me. You've been doing this. This is your, I think, 9th year as a practice owner, right? And so
Yes.
my third book, right, is called The Dentist, America's Healthcare Hero, Unsung Healthcare Hero. And one of the team members sent this to me, and it says, this is a defining moment because of the shocks and jolts in the world. There's going to be a new normal, essentially the ruined medical system. And if someone doesn't step up to the plate, what's going to happen? We're looking at the many years of ineffective care and mass suffering with no end in sight. The dentist is the next great American hero, and it's up to you to step in and lead the charge. And when you went from a standard drill, fill, and bill, associate, if you will, to where you are today, let's unpack that a little bit. Like, what does this mean? What do you take away from this passage that I wrote 9 years ago? I can't believe I wrote that 9 years ago.
Yeah, this sets, it means a lot to me. In the past, or I guess right out of school, you're just taught to be a problem fixer. So you wait till the problem happens and then you fix it. And that is not a good way to be. I mean, yeah, we have to do some of that, but my gosh, why do we wait till things get bad before we fix them? I have a case in my practice that one of the first patients I saw, he's this German guy, nice man, but his teeth had so much acid erosion on them. I was like, I don't want to touch him. I'm scared of him because if I touch one thing, I'm going to ruin it. Things are going to go awry. And, it just was so complicated. I didn't even know how to wrap my head around it. And over the years, we've, done a lot of work on him. He's now a full mouth rehab. He's being treated he wears a sleep apnea guard at night, so he's corrected his acid erosion issue. And he has this beautiful, healthy smile. And just being able to say, okay, yeah, he's this guy with these horrible set of teeth he's going to lose them. And I'm going to just focus on, he's got a little buccal pit decay here. I'm just going to fix that and not look at that whole big picture. That's crazy. And today, I just saw him not too long ago, and he's been in his full mouth rehab and appliance for years, and he's healthy and he's happy. He's a professor. He wants to be taken care of. He wants to smile. And the funny thing is, like, his wife was so funny. When I talked to him, finally got the courage to take care of him. His wife called me and she said, I looked in his mouth. Have you seen his teeth? Yes, I've seen them. And I felt bad because I hadn't taken care of him up to this point. But thankfully, I saw the light and realized, hey, I need to look at this differently because this guy's going nowhere but down. And if I don't buck up and start doing my job, I'm not taking care of him.
Yeah, so we're going to talk about what had that shift. So this is not a time for business as usual. One of my favorite mantras is make the unacceptable unacceptable. Do not go back. If something was unacceptable before, do not allow it. I know sometimes, like with your own health or the health of your team or the health of your patients, there's, it's like front of the hand, back of the hand. The front of the hand is, I don't want to be a pushy person. The back of the hand is, you were a stand for that professor. And now, because you're coming from a place of purpose, his health is better, the health of your team is better, the health of your practice is better, his relationship with his wife is healthier. And you were the catalyst for that because you stopped making it acceptable for him to walk around like that. How does it affect your wealth? As a practice owner, you now got paid a full mouth rehab. He's now in a sleep appliance. It's the only shift which is inside of you. It's not out over there, Lisa. It's over here. And, so often, what makes this time different than any other? Well, the whole world is simultaneously dealing with the same thing. So it's a flat playing field. Everybody's dealing with it. The other thing is, it's not a problem, it's a predicament. A problem is, wear on his teeth, fix the problem. It's like problem solution. This is a predicament. This has way more moving parts. It's like ending hunger or ending homelessness. There's a lot of layers to it. One of the things I learned is, like, as you know, I'm 12 years sober last week, and my wife came to me. There's only 2 times we change: when we're forced to change or when we choose to change. Most of the time, we are dealing with the force to change. This is forcing us to change. If you're an introvert, a non-confrontational person, like you said, I got to buck up. When I first met you, come on, Lisa, you were sitting there and I called on you and you were like, don't call on me.
Yeah, I would literally almost have a heart attack in the chair if I had to speak in front of a group. And, it's an interesting thing, because that's how you grew up, that's how you are. And it just took some training with you and your team, and I realized that I am made of the same thing that everybody else is, and I have a lot of education and I have a lot of knowledge that my patients need, and they're not going to hear it unless I have that courage to bring it up and speak to them. Same with my team. If my team members are creating disharmony and upset in my practice, if I don't have the courage to change it, it's not going to change. And it takes me a while sometimes to see that, but thankfully with your support, I don't just sit there and take it anymore. I make a change and we move to the next. We can move on and we can grow. Because when we're in that constant state of things being dysfunctional or something's not working, you can't grow, you can't get past. You've got to take that step.
Yeah, and the thing I learned, because I was like you, I was like, if I can't do it myself, I'm not going to do it. I learned a few things through like dealing with the change that I had to make and getting sober. My son was diagnosed with autism 12 years ago. 12 years ago, I quit alcohol, and now I am like free. My son's off the autism spectrum, so I've been through a lot of crises, personal, and then 9/11, 2008 with the Great Recession. 3 things I learned: you're not your circumstances. So our circumstances don't get to say how I'm going to live my life. I get to say that in the face of those circumstances. So yes, there are circumstances and they never change, but who am I going to be in the face of them? That's number 1. And who am I going to be is I'm going to either be a victim or I'm going to be a victor over them. So there's always a solution if you look for the solution. If you're looking for the problem and mired in the problem, you're going to find that too. And then the third is, it's okay to ask for help, Lisa. I was like, I look like weak if I raise my hand, right? And you're so good at surrendering. See, most people don't understand that surrendering, there's 2 types of dentists I'm dealing with. I probably have dealt with 50 already this week, interacting one-on-one. I've decided to go boots on the street to hear what's happening in all the offices that we're working in. There's the dentist who is sitting back and having things happen to him or her, or going, okay, this person doesn't want to come back, fine, we're going to surrender to that and move on and find someone else. And it's like, if you get mired and hooked into circumstances, you get stuck. And we want to get everybody unstuck and get the biceps going like you have on your data points, which you're going to see in a few minutes. We're going to show your dashboard of your practice. It's going to be awesome. So that being said, I want you to get the new norm of running a practice. You may not be able to see this far out, but that's my job. You're going to have less time. So you got to have more PPE. You got to spread patients out a little bit. You got to have them come in the parking lot. We have to have teledentistry. There's a lot of systems that we need to have in. You're going to have less time to do what you need to do. So constrain time. In Nevada, we have to go to 70-minute hygiene appointments. That's less time, less revenue. So, it depends on the state. We have to deal with everybody differently. Less time. Increased expense. Even if I just add PPE, and we don't even have insurance coverage yet, we're working on that and we're trying to get that in. But I work with suppliers and we're talking $15 to $18 per patient. Multiply that out times 20 patients a day, times 4 days a week, you know, that's $1,200 a week, times 50 weeks is $60,000. So $60,000 right out of your profit, just putting PPP in. So I got less time now. I got bigger expense. Patient scarcity, consumer confidence. People are coming off a few months. Some people made more money, so it's not that bad for some. But what we do is we map out and we think, oh, patients aren't going to think that they have money. You want to assume that they're going to be in a scarce mindset. When somebody's in a scarce mindset, people only spend money, Lisa, as you know, for things they really want. So how do we make the things they need things they want? And that's what we have to be masterful at. And if you understand what they want is that last bubble, which is health, and you turn your drill, fill, and build practice into a whole body complete health practice, you can now, those first 3 bubbles that are negatives, turn it into a positive and then be able to charge for it, have people show up. Like you had one cancellation last week, right?
Yeah, that's it. Yeah, it's, you know, I was, you know, we all have uncertainty, so we wonder how it's going to be, but my patients, they are so excited to be back. We have in one of our treatment room, or our hygiene rooms, I guess both of them, this mouth-body connection, and it shows just kind of a diagram of the different diseases that are associated with the mouth and body. And just yesterday, this man was like, you know, the left side, I have all of those there, and I have gum disease. And, you know, it's just, they get it. And so we had the conversation. Yes, Marie, now it's even more important because as you see on the news, people that really have a hard time with COVID-19, they have underlying health issues. So we have got to make sure your mouth is perfectly healthy, and they get it. And, you know, right now, I think our soonest hygiene opening is in August, and that's not going well. People are upset. They want to get in, and they get it. And I'm so glad they get it.
And, you know, you're speaking from like the after photo. And so it's like, you know, it's sort of like before cosmetic dentistry, you have some are teeth, some are over here and some are over there. And like, here's Lisa, hair swath on the side, big grin, 1 cancellations, that's the after, right? So, you know, you came from introverted, non-confrontational, you know, just like, you know, more of the drill, fill, and build, and you built this complete health practice. And I want to distinguish what complete health dentistry is. For doctors and practice owners, for their families, for team members and their families, for the patients and the patients that are not patients yet, your entire community. The practices like Lisa in St. Louis, you're going to see her vision of standing for getting people in St. Louis to be the healthiest in all of Missouri, right? That's your mission. So yes, most people think of complete health dentistry as physical health. It's also mental health. When you get your smile done, when your practice runs well, when you're doing what you love to do from your purpose, your mental health gets better. So if you're out there and you're grappling with mental health, you know, complete health dentistry is when you put purpose in versus fear, when you put in that faith and purpose, all of a sudden you're coming from a new place, and the voice in your head that brings down mental health. I lived in depression. I didn't want to live and I didn't want to die when I was going through coming off of my alcoholism. And the opposite of addiction, Lisa, is connection, being connected to you. You give me my purpose and passion because you allow me to serve you. Today, Lou and the team at Vatech and Jim, Paul, like being connected here, being of service to people, shifting, having to, like, I don't have to do this. I get to do this. That paradigm shift. The next is social, connected to your community, connected to your team socially, being freed up from physical pain and mental pain and financial pain to be present in every moment. Like you with your daughter, like I love seeing you on Facebook. You and Ava are the cutest things in the world. Like it's like, where is Lisa and Ava? What are they doing today? You're related and connected. And you go in and out of that, of course, right? But you also develop yourself socially, right? So that experience is important to you as a mom, right?
Right. So important. every aspect of this is so important. And, I just an awareness I had this week about the social, just our office we did a scholarship with our local high school, and of course set it up before COVID-19, and then they came and they're like, do you still want to do this? I'm like, yes, I still want to do this. This is so important to me. I'm a first generation college student from my family, and I want to do that for somebody else. And we were able to do this for this young girl and help her go to Mizzou. And my team, we were crying. That is such a beautiful thing to have that with your team and be able to give that into the community. It's not just dentistry, it's a way of being. And when you bring that on, it's just the rewards are endless for everybody involved.
Yeah, and if you don't get the next one, if your money isn't right, you can't join the fight. You can't do those things. And so teaching you about money and exchange and learning how to receive acknowledgments, receive money, like that's in the second year of our curriculum I wrote a book called Raise Your Healthy Deserve Level, because a lot of people came from you and I. We came very humble beginnings, very, very poor families. And so we never were taught on how to receive money and success. And that's part of the complete health dental curriculum, is learning that. And by the way, if you're wondering, like, why are we talking about this? If you can't, what's underneath it all is, so often we find doctors can't even present a full mouth case because they don't think they deserve to do it and get paid for it and all those elements, right? You grappled with that, right?
Oh yeah, it is. Yes. I love dental school. It created a path for me in my life, but I think a lot of the lessons you learn there too were, just at least at my school, not everybody's school is the same, but we got a lot of, just you had some confidence issues because you got a lot of negative feedback sometimes, and we're judged or something when really you're trying to do something. We're all going to make mistakes, and so getting feedback, yes, we all need feedback. We need to make sure we're doing a really ethical, good job on things, and give somebody the peace of mind just to do it and to try it and know that they're not coming from a negative place. They're doing the best they can, and I think that's just so important.
You bet. And the last is spiritual. You're talking about having a spiritual connection to all things, whatever that definition is for you. So really being connected over here in the heart rather than the head. The head is where I want to get you to move 18 inches down to the heart. And that's where dentistry done from the heart really makes a difference. And as we go, nothing's impossible, right? I thought it was impossible to quit alcohol. And here I am 12 years running consistently, and I haven't done that. I became willing. The difference between the successful dentists now and the teams are, willingness. And so what we're going to give you today is a framework for thriving in the new practice, and it's going to improve the health of the patient, team, and the practice by elevating the importance of healthy mouths on overall health. And, we're all walking around N95s. People are not walking around with eye masks or ear masks. The mouth matters, right? Because we're having to cover it. So therefore, that's going to shift everything. So I love this. For those of you, for millennials, this is called an Etch-a-Sketch. You turn the knobs and it does all that. And then all of a sudden, when you're done doing that, you turn it over and then this happens. So that's where we're at right now. We're at what we call a blank slate. And what's possible on this, Lisa, on that blank slate? What's possible? Everything, right? Anything and everything. So that's scary for people, right? So I want to bring up a distinction that I love. It's called a filter. It's a subconscious and automatic screening process that only validates your particular point of view. So no one likes to be wrong about their beliefs. We all have beliefs. These beliefs, what we do is we search for the validators in the world to make our beliefs right. Patients have no money. There it is. She said she had no money. Well, I look at that and my filter is, my job is to be an advocate for that person's health, because dentists and dental teams are the only place that a patient comes back twice annually for an hour to talk about health. And if you're talking about Johnny's soccer game or you're talking about health, I hear you don't have money for that. Well, are you healthy? Let's see if you're healthy. If you're not healthy, let's talk about how we can help you turn what you don't think you need into a want so that you want it, and then you invest in it. And then everything works. The whole ecosystem works from that. So I just finished my book. I, had nothing to do. So I figured, might as well just write a book. So 8th edition, $1 Million Dentistry. Some of you read the 1st edition. Bounce back from anything. And I want to talk about, Lisa, what are the new concepts in the new edition. We were just down in Belize. By the way, we were in Belize and we created this new mission called Health is Greater Than Disease. And do you know the only country on the planet, I just read, Belize is the only one that doesn't have a case inside of it. That's crazy.
I didn't know that.
So I learned that too. And so creating health is greater than disease is the mission. Big new the patients listening newly, and that asymptomatic, they know what that is. And so, in the old school dental model, we were going, hey, you're trained by your professor to find the chief complaint and fix it. So you would ask the questions for looking for symptoms. That killed off whole body health. And that really is the reason why when you have a good cone beam scan of the whole body, you can talk about asymptomatic conditions, because you can cure blindness, as Lou says, and actually see what's going on from the neck up if you have, the right screen, right? And you look at that when you now have a cone beam scan, Lisa, differently, right? I mean, you're looking.
Different.
How do you look at it? How do you look at that?
It's just it's mind blowing. I often think about this case that I had a woman who was going to get a hip replacement, and her surgeon wanted to have a, clearance that everything was healthy in her mouth, and gum-wise she was fine. We took an FMX, she looked fine on that, everything looked normal, and she's like, my upper left tooth, it just feels weird, it feels different, and so I said, let's get a scan. So we got a scan. Horrible infection. You couldn't see it. You could not see it. I pulp tested the tooth too, and just her feedback, she said she felt cold. Well, there's no way she felt cold in this tooth. It must have been from the gum tissue. But it's just nothing can hide, and the unknown is not unknown anymore. It's there. I remember sometimes, in school, if somebody has a toothache, we can't figure out what's going on. It must be the sinuses. It must be the sinuses. Let's just put you on antibiotics to see if it's the sinuses. Well, now you can see, how do those sinuses look? You don't have to guess anymore, and that's great. You don't want to be taking antibiotics for no reason, and it's a whole new world.
Yeah, and then we start. You were just talking about, our gums look fine. The inflammatory burden is tremendously different. So those, we have 10 million treatment plans in our database, and only 8% of dentistry of soft tissue is diagnosed and 4 treated. Now more than ever, the patient all of a sudden understands the inflammatory burden with Kawasaki syndrome. The whole deal with what's happening, why these kids are dying, it's because of the multi-system inflammatory syndrome that's kicked in. It's not the virus, but what that kicks in inflammatory-wise, and these kids can't survive it. So now more than ever, the patient understands about the inflammatory burden, and that's where we're going to show you the education system that we had built to, educate around that. Comorbidities. You're now looking at the medical history form different. You're not saying, did anything change? You're going, let me take a look at the 3 elements of diabetes, obesity, high blood pressure, and you're looking at it differently. But if you don't shift the context that you're not a drill, fill, and PPO mill, you're a complete health practitioner. Now, all of a sudden, this is how you overcome people not wanting to come into hygiene. That just fixes your hygiene openings. It fixes your case acceptance. And those things need to rise if you're going to outrun the loss of time and loss of expense. Tying the comorbidities into dentistry, hydrogen peroxide. I'm going to show you the ADA requirements. You got to be swishing, swashing. You got to be, we now know hydrogen peroxide vaporized can sterilize an N95 mask if it sits for 72 hours. PerioProtect is a big delivery system for addressing bacteria and inflammation. So hydrogen peroxide is a big deal. Wouldn't you agree?
Big deal. Big deal. I shoot myself for not getting into PerioProtect sooner. Just the changes I see in patients who are dedicated to using it is amazing. I had a woman with Parkinson's who I just saw yesterday. Totally different mouth from where she was a year ago, and it's a big deal. It's amazing what just getting oxygen under those gums does. It's impressive.
Yeah, and also getting to the truth, like no more wishy-washy leadership. We now know video conferencing. Everybody has video set up, so we can now do teledentistry. We can set up patients and get them prepaid using teledentistry. We can also eliminate emergencies on the backside, so we have to make up time somewhere. Where we're going to make up our time is on our backside of not having the patient drive all the way to the office. We're going to be able to do it on a video conference. Bam, 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 knock it out. So we're going to free up time in our schedule using video conferencing. The team, entitlement. I want this, I need that, because we had low unemployment. It's like, if you're not great, if you don't have a team full of grateful people, that's the line in the sand. They're either grateful or they're not for their position and working with you. If not, then you, team members, you shouldn't work in a place that doesn't treat you really well and cares for you and gives and shares in the growth of the practice. So it goes both ways here. Solvency, we're going to show you how to be solvent during these times. Leadership has changed, management changed. This last one I want to really highlight, lower no-touch dentistry. As I mentioned, after 9/11, we didn't envision all the things we need to do. Now I'm a clear guy. They look at my retina at least, and I'm in, right? Because I don't like doing all that other stuff. In the dental office, we're going to have to go to low or no touch. That's why it's so important. Extraoral, pictures. You don't want to sit there, inside a mouth all day doing FMXs. You could just zap one shot and you're done. That's why I believe the CBT. I know, well, it's not declared, but look where it's going. We're going to want to minimize all that. That's why you need to have a scanner. That's why I'm here, because I partner with Vatech. And that's why we need to do it, because of low and no touch. It just minimizes stuff. And the team, you just want a team that rocks. We're going to also talk about implementation, because if you don't implement change, it's not going to work. Here's the 5 elements that Lisa has in her practice. I'm just going to briefly give you an overview, and then we're going to take a deep dive, Lisa. The purpose of the practice. So, the practice has to go from a standard practice to a whole body health practice. Key to this. If the context is not whole body health, then you're going to have people all over the place delivering a different message. Also, people's roles. Like we don't have hygienists, we have hygienists. We don't have just assistants, we have ninjas. No, I'm not just an assistant. Change the purpose of the individual roles as well. It changes how they think and how they operate in relationship to their roles. You got to have the right people in the right place doing the right things with the right measures. So we're going to talk about what measures should you have, because you have to operate your business as a business. If you don't have goals, 80% of the dentists I start working with do not have targets, and they don't have targets by position. So we break it down by annuum, by month, by day, and then by person. And that is key, because then you have accountabilities that are equal to what the dentist needs. And I'm going to show you how to do that. Then there's only 3 systems: case acceptance, retention, and the new patient. Then what we do is we have to automate, because we have to get much more efficient. Analytics and how the team is behaving, marketing systems, team training, teledentistry, and your diagnostics all need to be automated. Get rid of those FMXs, do one scan, simplify, easy, automate. And then we're looking at doctors, pay yourself first. If you were carrying checks, uncashed checks around, cut that out. We're going to have you pay yourself first, reverse engineer your expenses. This is the time to do it when you have an Etch-a-Sketch blank slate. And your biggest expense is turning your payroll into a profit center. We're going to show you how to do that. There's 3 types of expenses. I want to give those to you right now: destructive, consumptive, and productive. Destructive is if I buy a bottle of wine, lease $20, I lose my life, my family. That's a destructive expense. Not only is it $20, but it costs me in my life. Consumptive is go on vacation, and there's no really dollar for dollar. Productive is dollar spent for dollar return. You want to be in that mindset of productive expenses. All right, so let's do it. Let's get on with it. There's tons of gum disease out there. This is the root cause of inflammation. The mouth is the gateway to whole body health. We got to treat it. Like I mentioned, 8% diagnosed, 4% treated. and no more bloody prophies. The entire team knows the standard. This is the foundation of the work that we're talking about. The comorbidities, the connection of gum disease and its connection, instead of saying this is something I really got to get on board with, my suggestion is something that you have a responsibility to deliver even before pandemic, but even now, much more after. Anything you want to add here, Lisa, about this philosophy and thinking?
I just think when you take this on, your purpose is just so different. And I think that's just, I love my job. I love being a dentist because of taking this on. It's changed my way of being. It's changed my life. It's changed the people I work with, my patients, and my daughter's life. And I just think it's the way to be.
And one of our colleagues, we have a whole community of people, and Lisa's in St. Louis, and one of our colleagues is down in Jacksonville Beaches, Florida, Michelle Huckey, and she says, if I never drill a tooth again, I will be happy. And she's like, I never drill a tooth again because it has, I'm drilling a tooth, the tooth has connected to a person, the person's connected to a family, the family's connected to the community is affected to humanity. She realized that she shifted her relationship to drilling that tooth. And when you do that and you move your practice from transactional dentistry to relationship-based dentistry and whole body health dentistry, see the right side of my mom passed away 4 weeks ago. As you know, Lisa, thank you for your kind words from COVID. She was in a nursing home in New Jersey. Half the people in the nursing homes in New Jersey are passing because of COVID, and her age outlasted her health. But if she took care of her health, that left side of the channel, she could be living fully and would have not been in that nursing home and wouldn't have had the same percentage of risk. And so if you take the responsibility as a dental team to your product is longevity, your mindset shift is way different, and you wake up into a different world. And so we believe that our dentists are frontline workers because the mouth is the front line for whole body health. We believe that, we know that 12% of emergencies in emergency rooms are dentally related. And if our dentists do our job, they can eliminate those emergencies. And I want to acknowledge the frontline workers, all of you, for the work that you did, helping out everybody. And dentistry is not in the conversation of frontline workers. In our world, it is, right? In our world, we believe that, and therefore we create that. And when we elevate our own games, we create a world that is engaging our teams, engaging our community. And you've observed that, right, Lisa? You went from, shut down associate to a bold declarer of we're going to transform the health of people in St. Louis.
Most definitely, it is, and it's, in St. Louis, as during the COVID, the big shutdown, there weren't a lot of people open, and you get to see people from other practices coming in because we did still take some emergency patients at that time, and it just. I think if you look at it from a broader spectrum, you are helping people so much, and that's why I do what I do, because I want to help people and I want to be there, and being able to do that in times of COVID-19, but also anytime. I think that's changing their lives, changing them to be their best version of themselves. That's what we all want to be.
And once you have that mindset shift and that philosophy and your team gets bought in, now all of a sudden what fits under that umbrella are things like hydrogen peroxide, understanding extraoral dental radiographs are the standard of care. You ask, how's your overall health, not just your oral health? And then in this time, we want to have a 90-30-1-1 approach, which means 90-day plan. Inside of that 90-day plan, 3 30-day plans, because we didn't know how it was going to be for you going in. we could anticipate, but we didn't know. So we put a 90-day plan, and then we had a 30-day plan. Now that we can look up and see, oh, okay, we're good. Now we can tighten things up and get planned for the next 30 days. We are building this plane while we're flying it. If you're trying to create long-range goals, please don't do that. Have an idea what you want to do for a quarter, break it down by month, and then 1-in-1 gives your methodical people that don't like pivoting and change that you have the right to change it daily and even every hour. So it gives yourself and your team the opportunity. If you learn new regulations, learn new things, you can make those changes. So the 90-30-1-1 is really important. I want to put up the WhatsApp Uncertainty webinar. Each Tuesday, we have a webinar. It's at 4 p.m. Eastern, and we have all the latest. I lead it. I have a panel, and we bring people from suicide prevention to PPP. We got people that get their loans fast. If you didn't get a loan, what to do. So that comes in, and WhatsApp has gone viral, and it's a global centerpiece for the latest happenings, evidence-based, good, clean information. And we'll put that up in the chat so that you can get access to it for any Vatech user. If you're a Vatech user, you'll have access to that. And your vision is you're a stand for the people of St. Louis. You see, what does that mean to you? You're a stand for people of St. Louis, having a vision, having a mission behind what you're doing.
It means so much. I want my community to be healthy. I want to be just like a integral role in getting St. Louis healthy, whether that's dental care, whether that's helping out a high school student, whether that's going to the nursing home and giving out toothbrushes and oral hygiene instruction. Everything we do, all of our actions create health, and that's a very powerful thing.
You bet.
It's like what do you always say? The butterfly ripple effect. One little thing, and just it spreads. It does spread.
The butterfly, there's a butterfly effect, which means if the butterfly flaps here and around the world, it can create a tsunami, right? So that
Yes.
There's a book around that, and that's true. You don't realize when you drop something in with purpose, it goes far out. And these are the 4 phases in that 90 days that we'll look at. Make sure that you're safe, the team's safe, your patients are safe, that there's solvency, and we restart like you did, and then we surge on the backside. How do we do all that? Well, one of the key things is to really speak to the internal customer first. Make sure your internal customer is your team. They feel safe. They're taken care of. You listen to their needs and wants. Then the external customer. My suggestion is speak to the 10. You know, not everybody has the same fear. Like I talked about filters, don't map your filter out over, if your filter is, this is a hoax, you know, then if you put that out to people, you don't know what your beliefs are of your team members and your patients. Speak to the 10, create for the 10. I'm going to show you how to speak to them and set them up. So get your recorders ready. And then we are learning from others. We're looking at other countries, other industries. We're building the plane while we're flying it. If anybody tells you they got it figured out, don't believe them because they don't know. We've never dealt with this before. And there's 5 buckets. I do want you to look at the 5 buckets as you set your practice up. There's 5 key buckets here in the complete health model. So one of the things we're recommending is calling 3 days ahead. And we actually, if you set up with our teledentistry platform, it's operadds.com/next level practice. If you want to get a good teledentistry system, you can use that for free for a month. This is amazing. These 5 things, when you say we're calling ahead, we want to welcome you back, patients. We want to let you know what we've done newly so that you can feel safe when you come in. We have the latest in PPP, mask gowns, shields. We have taken a proactive stand with our air quality. We have UV for our air conditioning, our heating, our water. We have air purifiers. We also, we're going to let you know that we're going to be, you know, that ultrasonic we use. We are now in the short term going to go back to the old way of what we call hand scaling your smile, so that we're going to do it that way. Also, we have physical flow. So like when you go into the supermarket, you go in one way and you follow the flow around so we don't crisscross. We also have what we're calling a no-touch or low-touch office. You can now wait in your cars. In our teledentistry, we're going to send you a text. You text us when you arrive, and then all of a sudden we'll say, we're ready for you, you come in. We also have CBT scanners. What that means is we're not going to have to go do x-rays inside of your mouth. We can just have you sit there and we do it outside of your mouth. A no-touch dental office, very powerful. And then we have complete health dentistry, where we follow the ADA guidelines of hydrogen peroxide and mouth as the front line for whole body health. And so we're excited to have you back. And, you know, patients that have been trained, like Lisa's patients, from a complete health model, what are they saying to you? Like, hurry up, I know, I feel like I'm like late here.
They're excited. It's honestly, it's so refreshing. It feels so good because they value it. They see the value and they want to be there, and they want to be healthy. And, you know, one of the biggest values, I've got so much values of next level, but dealing with COVID-19 made it night and day difference for me. The whole time, you know, I remember the first week, it's like I was freezing. I wasn't certain what to do. I was scared and I couldn't make decisions, couldn't even think. And the WhatsApp app you mentioned, everybody's doing ideas and, hey, check this out and think about this. And being around like-minded people who are supporting you and helping you and thinking of what all these things preemptively, so we were ready to start. We had it all in place. Priceless. It made me sleep at night. It made me so comfortable, and it was amazing.
Well, it's the power of community, and that's what I love about Vatech, because they have a community of practitioners. You know, they wouldn't have this webinar if they didn't have a community. So you really want to tap into a community. I want to reach out to Jim and Paul. I want to honor the time. If I can get another 15 minutes inside of the question and answer piece, that would be great. Or I can end exactly at 1 o'clock, and I can do Q&A. So Jim and Paul, if you can jump in here, I'd like to continue if that's possible, but I'm going to take your direction. Can you jump in?
That's perfect. You can go ahead and continue on. Yes, thank you.
Thank you very much. Is this good value for you and your guests today?
Yes, we're getting a lot of good feedbacks on the comments and questions for sure.
Excellent. I love having Lisa here because she makes it real, you know. Otherwise, it's like, you know, sitting in some classroom somewhere, you know. That's why I really love Lisa. Thank you for your transparency and your courage to share, you know, your experiences to what's happening and give hope to people.
I'm very grateful to be here. I'm very grateful. Thank you.
So let's talk about the business model. You know, most dentists are going back and they're focused in on people only. You know, if I'm playing chess and you're playing chess and you can pick any piece of the game, you know, most people, Lisa, pick the queen because she can move the most places. But I said any piece, I pick the game board. See, dentists that are going back and are picking the game board are going to be able to have a solvent business, because you have to teach your team and you have to get your team on the same page. If you don't do this piece, this is where you have a personality-driven business versus a business model-driven business that people happen to work on, and they buy into that business philosophy. So let me just give you some quick numbers here. If you want to collect 2 million, you write 10% off, you have to produce 2.2. This is where doctors, if you want to take more time and time off, you know yourself, we fill time to meet the deadline. If you just have a finite amount of time and a target for how much money, now we just say, this is how much we need to do per day. So 1 doctor at 6 weeks off, 2 hygienists, we call hygienists, 368 days of hygiene. $1,000 in hygiene is very low for a complete health practice, but I'm being real conservative. 368 days times 1,000 is $368,000. If you want to produce to 2.2, you need to do 368 in hygiene. That leaves doctor production of 1.8, 184 days, 10,000 a day, pretty much for your doctor production. What most people don't look at, Lisa, as you know, is their case acceptance conversion rate. And they don't look at how much we're presenting. And by the way, when you put, I'm going to show you case studies at the end here. When you put a Vatech unit in, not only is your total case presented on the front end grow, your case acceptance on the back end grows. You've seen that, but we're going to show case studies of many practices that have done that. But if you don't have these targets, you're never going to know how much you need to do. So now we know that the hygiene daily primary outcome is 1,000, the doctor's 10,000, and then how much you need to present per day is 15. Now all of a sudden we create, and DOFIs are directors of first impressions. They have an outcome-based game every day. They're just not filling the schedule haphazardly. They're filling it to an outcome that is correlate with how much time Lisa wants to work and how much money Lisa wants to make. And she shares that with them. I'm not going to get into the bonus system, but the bonus system is paid out, is calculated daily and paid out monthly. So when you collect 167 for the month, a team member is looking at the collections because they don't get paid because they know the doctor can't pay that bonus if the collections don't cover the amount needed to collect and pay you. And then each day, like for instance, the daily, the DOFI here gets paid $10 per column per day. So they get $10 for the doctor. When there's 10,000 at the end of each day, 1,000 for each hygienist. If you have 2 hygienists, that's 3 columns a day. That's $30 times 16 days, $480. Doctors, if you collect 167 and you've got your production in your hygiene columns and your doctor columns every day, wouldn't you pay out $480 extra to this amazing human being who produced that result? Please, all day long, right? I bet you can't wait to cut those checks at the end of every month, right?
I do. I love it, actually. I want them to bonus. It's such a fun time and they all get so excited.
Yeah, and when you don't, here's what happens. The team's going, darn, I got to change my behavior. I can't continue not to, let somebody cancel and just walk away when they call in. I got to get better at that. And then that's how you get your team driven to look at their numbers, which they don't want to. They look at them as enemies if you don't shift their paradigm. And then they also look at those numbers and go, I need to get faster at running my 440, the equivalent of that, right? So, and then each position has that as well. There's only 3 systems: case acceptance, retention, and experience for the new patient. Lise, thank you for letting us show your dashboard. I'm going to bring that up right now. Can you see your dashboard? Do I have to change the screen or can you see it?
Yeah, I can see it. Yep.
All right, great. So this is you with muscles, Lisa. Lisa's showing the muscle right there. And I just pulled up last year's treatment presented and treatment accepted. And then having a dashboard, and by the way, this is the free snapshot that I'm offering everybody at the end. You'll take a picture, click on that, and Vatech is paying me to do it. I'll get to as many as I can. I can't promise. If you get in early, I'll do this with you like I did with Lisa, but it really opens your eyes. And then we look at our treatment team and we can see that, and this is the biggest thing, your doctor hygienist conversion rates. And what happens is, like for instance, I now know that with Kadi, I can support her and she's at 36, but I get her up to 50. That's $70,000 right there. $70,000 just having her, do a little training and development, right? But most of the time, a dental office isn't looking myopically at numbers like this, so they don't know where the inefficiency is, Lisa, and they don't know how to correct that, right? You see that all the time, but having analytics allows you to do that, right?
Absolutely.
And then also like Fitbit, I created this because it's like Fitbit. When I was at 9,999 steps, I made sure I walked home from work because I wanted to get 10,000. Our case acceptance here, look at this. Case acceptance, this is for the month of February, 147 presented, 69,000 accepted, 47% conversion rate. So that day, that month, and I know your case acceptance needs to be a little higher than that because of your measure. But now look what we're doing, Lisa. You're now looking upstream for your downstream numbers. Most people are looking at their bank accounts, their production and collection. They're not looking upstream like we look now because I know whatever you close in February is going to be delivered in March. Now, not this March, but you also had a lot of what we call pay-to-day courtesies. You did a lot of treatment this past week because that patient closes and they pay right there, right? Didn't you have a bunch of those you mentioned to me?
Yes, yes, it's a beautiful thing. They are going to show up if they paid for it, and when they finish and they don't have a balance to pay, it's a great win for everybody. I love this system because one of the biggest mindful things that I see from it for myself is when I show up and I look at, am I being a complete health dentist? I want to pull out my healthy mouth baseline. Is that what I am being? Then I know, I look at this and I see my treatment presented is at a certain amount. And then life happens and I've got like a team change or something and I have to be training. Guess what happens? My case presented goes down. And so I look at these numbers a lot because it tells me where's my head and am I being that person I need to be every day. So I appreciate the numbers a lot.
Right, but you shifted your relationship to them because
Oh,
that shows you your behavior. You
yeah.
can now take responsibility for your behavior. And when you do that and you train your team to do that, they embrace numbers as allies and accelerants versus enemies, right?
Yes, absolutely.
And then the other thing is patient retention here. You know, this was lower because of what we had going on, but 8 came in the front door, we captured 2, that's 10 new patients. But what most people aren't looking at, Lisa, is the lost patients. In 18 months, in February, we lost 14. Now our patient base is shrinking. So we're going to work on this, but now we're ahead of it. We're not going to look 2 years from now and go, how did our patient base shrink? Because it's just chipping away, chipping away, chipping away, and most people don't see that. So I'm grateful that we were able to share that, and you know, that's key to the whole process. So I want to just get back here and I want to, did I lose you? Lisa, can you hear me?
I can hear you. Yep.
Okay, I got all kinds of things going on with my, wow, it's now recording me. This is awesome. Great, I got all kinds of good stuff happening. I think I fixed it. All right, so I'm gonna skip this part because I wanna make sure I get to the key part in the end. Let me just pull this out and let me shift to, so I wanna just get the 5-step process, Lisa. So
Yep.
I'm gonna go to that next. So one of the things is when you go to a complete health practice, you read the medical history form differently. You don't ask, has anything changed? You're looking at your history, the family history, and you're tying the comorbidities, the chronic disease to the mouth. So you're relating to it differently. You're going to say, how do you feel about having these conditions? Do you know that taking care of these are much more important now? And all of a sudden we elevate the game in a different way. We also have, you can go onto this website, take a picture of partnersincompletehealth.org. This is if you now have somebody who comes in and they come in and you see they had a stroke or diabetes or whatever, these are the bridges from the medical history form to how it's affected in the mouth. And so we systematize this so that you don't have to, you know, have uncertainties or doubts. This is all science-backed. You'll see is how is diabetes related to the mouth. It has all the websites that show all the science, so it's science-backed. That's really important in today's world, not just some theories. And now you're turning into a medical history form tied to oral systemic health cards, and then you get into what we call the 5-step healthy patient blueprint. And this is the turning point for most practices. You know, one of the things I saw is people hate to sell in dentistry, but if they have a step-by-step process where you're walking a patient down the path, now all of a sudden they buy emotionally, which is the personal motivator. The healthy mouth baseline is the benchmarks for what's healthy. The problem consequence shush is you got cone beam scans, you got intraoral pictures, you got visuals. The trust transfer moves it from the back to the front, and then fitting the treatment into the patient's lifestyle is removing money as a barrier. So you have to get into what the world is. It's not it's what's important to them, and it doesn't have to do with dentistry. It's like, oh my gosh, I'm into health and wellness. You know, nothing hurts me, but you know, my divorce is over. Maybe I want to take a look at aesthetics. You're into the world of the psyche of an individual and what they're motivated by, and it's removing force and telling people what they need. It's really moving into letting the patient discover for themselves, and how we do that is something called the healthy mouth baseline. And the healthy mouth baseline is the standard of care, which is higher in your practice, Lisa. People now are beginning to educate because they don't know what's healthy and what's not. And a lot of times the team doesn't always agree on what's healthy and what's not. How did the healthy mouth baseline shift your practice?
I think it just takes the ups and downs out. So sometimes we would present different things to different people based on filters and what they want. And really everybody needs health. So that's not a good way to treat patients. So it's our standard of care, and our healthy mouth baseline, you get checks. The more checks you have, the better. And our patients come in and they're like, okay, I have more checks today. They understand it. And so you don't sell, you don't have to pressure. It's just this piece of information. It's your scorecard, and you got great checks here, but this is where we need to work on, and this is what we need to do to get those check marks there. And it just makes things much easier. It really does.
And then you just highlight the problem and the consequences. You show visuals so people can see them. And then all of a sudden, you can't refute a visual. And then you move what I call the hallway of amnesia. They said yes in the back, they move past room 5, 4, 3, 2, 1, and they forget everything. Well, we eliminate that with the trust transfer. So the ninja or the hygienist to the patient, then to the doctor to the patient. And then we walk down the hall, and they hand them off into a treatment consult room, and that's when we present to the patient. 5 simple steps that allow the patient to move from the back to the front. And then we remove money as a barrier, because now the treatment coordinator is what we call the financial freedom fighter, and they help them overcome money as a barrier in a beautiful, simple consult room, and life becomes gooder. So let's talk about the impact that this has. Now, this is a case study. This is a non-Vatech CBTC device. So you want to just look at this. Treatment, so this is the install date. This is where it was installed. The treatment presented pre is here. So we track this using our database, and the snapshot that you'll be able to get a free snapshot on. This is post. So look at, the percentage of change, which is good. And then let's look at the accepted amount. When you have, and this is where Vatech shines, which is the customer service you talked about, this is factual difference in terms of the impact. And then look at this, the patient annual dollars. Here's the dollars here, here's the post. Again, a lot of them are flat, one big one, but you want to just look at the difference between a non-Vatech unit and a Vatech unit. Now I'm going to move to just to review here. Treatment presented, change was 13%, accepted is a 0% of all them, and then the average patient value went up, which is 8%. But let's take a look at Vatech and what the difference maker is. Look at this. These are facts. These are clients of ours that have non-Vatech and Vatech. Look at the treatment presented change, increase of 64%, 6-4. These are the states. This is the date of installation. The device itself, the larger fields are better. In this case, we see the numbers here. They're irrefutable. Look at the numbers. Treatment accepted. Again, 36% higher. And then this is the big one. The average per patient value goes up 56%. If you're wondering whether you can afford a unit, you can't afford not to at this place, because these are the intangibles that people aren't looking at. You add these numbers and the no-touch dentistry need. We believe, and what we're standing for now is every office needs a CBT scanner, period, end of story, not only for what the regulations are going to be anticipated to be, but the difference it makes for the care in the patient. And this isn't selling dentistry, as you know, Lisa. This is just putting the right unit in with the right company, having the right customer service, and then taking advantage of these added value services, like how to coach people on case acceptance. So anything you want to say about this and your unit and what you've experienced?
I think you just see so much clearer what is going on in somebody's mouth. And the other thing that I've really noticed that's kind of an interesting I send all my cases to Beam readers. They read my case and give me this report. And initially I was like, oh, this is so much time. I have to call people to go over this. But taking the time to make those calls, those patients appreciate it so much. They get value out of it. And my case acceptance goes up because of that. So it's a win-win. No matter how you look at it, and it's safer, it's easier, it's more accurate, and you get more communication with the patients. And so it's priceless.
You bet. So we're going to talk about implementation, and then we're going to go to Q&A. Give me 6 hours to chop down a tree, and I'll spend the first 4 sharpening the axe. Don't go back to the same way. Get the axe being a strength multiplier where you don't have to effort anymore. If you want to play smart, just put in a business model. And I do a launch program for also, you work directly with me. We take an x-ray of your practice. You're going to get a free snapshot. And then from there, we can talk about the options that you have after that. So I'm going to end here. And what you'll get is we'll do a Zoom call, and I patch into your Dentrix, EagleSoft, or Open Dental. If you don't have those systems, we'll need to pull reports. But then I'll meet with you for a half hour, and at no cost or to you. And the cost is going to be, I charge a lot to Vatech to do this. I'm really expensive, but I'm worth every penny. So if you'd like to take advantage of that, you'll see the link here, and you just go to the link and sign up. And just please understand that I may not be able to get to you right away, but if I will get to you. I'm adding hours to help doctors out during this period. So Lisa, thank you for being here and giving the wisdom and the depth that you did today, and the transparency was huge.
Oh, thank you. I appreciate it so much, and I learn from you every time I see you, and I just appreciate being part of this.
You bet. Thank you. So my man Jim and Paul, we're gonna go to the videotape.
Sounds perfect.
Questions, thoughts?
We did have a few questions come in, and one of the questions, Dr. McDonald, you had addressed. I had someone ask if you are sending all of your cone beams in to have someone read, so you do take the time to have them read, go over that, and then get that evaluated through your radiologist. Gary, we did have some questions on the process of you dialing in and going over evaluation of the practice. It sounds like you can plug into the main practice management softwares and do a consultation session after you kind of run some numbers there.
Yeah. So yeah, Lisa does do the radiographs, and she gets them read. We recommend it because then you're getting a professional position on that, and some of the things that she might not be looking at. So that's for sure. For us, what we do is for doctors that are really serious, doctors that really are sick and tired of living the same way, but like, it doesn't matter where you're starting from, Jim. If you want to do this snapshot with me, one of the things, there's no judgment. I don't judge people like they're afraid to have us look at the analytics and numbers, or maybe they feel guilty or shameful of looking at them. And I do it in a very safe space where I really honor people for where they're starting from. And then we unpack these numbers, and the number one thing people leave with, I would say 99% of the time, is hope for a better future. And when people live in hope, what I've learned about hope, Jim, is that gives them the passion and energy to go out after it. If your future doesn't look better than your past or where we are in the present, the motivation is not there. The passion's not there. The will to move forward is not there. So just in that half hour, getting a clearer picture of where to go and how to get there gives people clear hope. And actually, like they usually go, Gary, what do I got to do? Give me the action steps. And that's usually what happens on that first session. It's really an eye-opening opportunity, because what I do is I really focus in on all the areas of opportunity that are missed in a dental office, and I call them levers. There's so many levers, Jim, inside a dental practice that are untapped, and not even like people. There's things that doctors know they need to do. There's things that doctors know they need to do, but they forgot. The world I work in is the things that they don't know that they don't know. And in that space is where all hope and possibility lies.
Sounds great. Thank you for
Awesome. I get paid to do this, Jim. It's almost like illegal.
It's good that we all enjoy what we do. I think that's one of the main things on there from what you're saying. Dr. McDonald, we had a couple questions for you on utilizing the new technology at your office of this no-touch or more extraoral imaging. Are you finding you're using more, relying more on a panoramic image or maybe bite wings with the Vatech device in addition to the CBCT? Or what is kind of some questions, or what is your workflow that you're trying adapting into your office once you're back, and we'll call it at the office after what we've kind of been through?
Yeah, so definitely, you know, our protocol in our office is to do a full set of x-rays every 3 years, and we pre-Vatech scanner would alternate pano FMX. Well, most of our patients have that. So now we're encouraging doing the cone beam CT along with 4 bite wings. I still want to see 4 bite wings because it helps me see decay and, you know, real clear view of the teeth in between. But that is our standard for our recare right now, is the cone beam CT with the 4 bite wings.
Perfect, thank you. Other questions were, when you started this next level practice, or this whole health dentistry, how did your staff react? Was it an easy transition? Was it, you know, I don't like change, so I'll be the first to say. So what is, you know, some of, you know, how did that transition go? If you can kind of give us a few words there.
Yeah, so it was, not all of them were on board, and that's okay. You know, I knew that I didn't want to practice that way anymore. And so I sat them down and we did what's called a line in the sand conversation. And I said, you know, I love you all. I respect you all. I think you're amazing people. And we do a lot of things really well. And there are a lot of things that we are going to do to just be more effective at what we do. We want to have more fun. We want to make a bigger difference and show them what I wanted to do. And, you know, some of them were like, nope, peace out. I'm out of here. I'm not interested. And I gave them, that's great. Perfect. That's a great choice. And the ones that made that choice, I was glad they made that choice, to be honest with you. And the people that said, yeah, you know what, I get it. I see potential in this. I understand, and I'm going to do it. And we created a safe space for them to get on that bus and come on board. And throughout the year, some people end up jumping off the bus. And, you know, I think that is normal. That is natural. We find people that, I don't remember who said it, but Oprah, but people are more comfortable at certain levels. And then when you grow a little bit, they might not be comfortable at that level anymore. So it's a normal process for you to kind of start changing your game, and then more people come on board. If it's done in a kind, peaceful way, and people understand what your vision is, what you're looking for, what you believe in, the right people are going to show up. And I've really realized that over the years.
Yeah, Jim, and if I could add to what Lisa said, I want to unpack it a little bit so people understand. This is so vital now coming back. What Lisa did there is something called line in the sand process. There's a premise that is underneath this that I want everybody to know about. She convinced against her will is of the same opinion still. She convinced against her will is of the same opinion still. When you move from a standard practice to a complete health practice, they were hired under the auspices of a standard practice. You invite them to participate into the future that you're leading them to, and they have a choice to come on board or not. Most people go back and they feel like there's just like this unspoken, like because you worked here before, you're going to work here now under these conditions. You have to give your team an opportunity to choose whether they're going to participate in the new level of playing, the new playing field. And so most people don't do that step, and then they deal with carrying people up the mountain, and then you get resistance and defiance. And we cannot afford this type of resistance and defiance under these conditions, Jim. Vital.
Right, for sure.
If anybody needs the script for what Lisa said on the snapshot, I will make sure you get it when you do the snapshot with me. I'll give you that line in the sand, step-by-step process. Everything we do has a step-by-step process.
Right, and so the audience knows this is all being recorded, so everyone will be able to go back through and view this via the Vatech website there. One other question, I think we're getting to the end of the questions, and it was, Dr. McDonald, we had talked before about implementing the cone beam. You've had the Vatech CBCT for a while, but we talked even last week, like, hey, I did this PA on a certain tooth. We were looking at a abscess. It wasn't there. I'm doing an endo, and all of a sudden I realized, oh, I have this new technology. I find I'm always learning and reminding myself of different ways to do things. How is that going as far as implementing and getting used to the workflow of newer technologies, be it the Vatech cone beam or other technologies you have in your office?
Yeah, so I'm a huge creature of habit, and I've been in dentistry 19 years, and I will fall back quickly on certain things. And, like, I think during COVID-19, I had this emergency root canal, and I took a PA and did the root canal. And of course, the 2 canals are more buccal than they should be. It's like tooth number 18 or 19. And I'm certain there's 2 more canals. I wasted so much time. I'm looking for them, and I'm starting sweating. So I'm like, I'm going to perforate this tooth. And I'm like, duh, take a cone beam CT. So we paused, get them out, take the CT. Yeah, there's 2 canals. And so I still get it thrown in my face, and I learn every day. There's just, we're just human. We're human, and we revert back. But to have that image and be like, yeah, that's a beautiful root canal, and thank God you didn't go much farther. You'd be removing that tooth. that's just a huge peace of mind, and it feels so good. There are always ways I'm learning with it. I dealing with sleep apnea, that's something I wasn't trained on in school, and so there's so much to learn from that. And in our community in St. Louis, a lot of the medical people are on a different understanding of it than what we are. I took some courses at NYU, and so it's a very big difference. And my own daughter was suffering from it, and so I got her in for a sleep study, and then saw an ENT, and they said, you know what, actually tonsils and adenoids, they look normal sized, and she had 1 apneic event, so it's normal, don't worry about it. Well, it's not normal. And my daughter's behavior was she couldn't focus, and she was dealing with all these digestive issues, hospitalizations, and a mess. And so I took a scan on her, and I emailed it to the ENT, and I said, these adenoids, she can't breathe, she can't breathe. And he no argument, okay, I'll schedule her, she did it next week. And so it's just a new, for me to have the confidence to say, hey, Mr. ENT, take these darn adenoids out, I want them out. And to have a picture of this image, and clearly she needed those adenoids out. Just, it's such a wonderful tool. And so I learn on it all the time. And, in the community of Next Level, there's support. I have been reading them now for a while. Am I great on them? No, but I'm learning each day. And I can have someone from the people that taught the course at NYU look at it and, hey, I'm seeing this. Is this what you see? So I am constantly learning. And, no judgments. Hey, they know I'm trying my best to figure this out. And I want other kids like my daughter to have that procedure, because it was life-changing for her. She hasn't been hospitalized in a 1.5 years now. She sleeps at night. She doesn't wake up with the covers thrown on the ground because she was thrashing around all night. She sleeps closed lips now, so now her face is developing normally. And it's it's such a win. And it's the possibilities are endless. And I'm on the very tip of it. I've got a lot to learn, but I'm super excited to be on that journey to learn it.
Perfect.
So.
Thank you so much for sharing. Yes, gotcha. That takes us to 12:30. I want to thank both of you. Dr. McDonald, thank you for coming on and taking part of your day. Gary, thank you for all you do for us. I'd like to thank the whole Vatech family. It's neat being part of not just in the Vatech world as a company. We reach out to our doctors, Gary, Kadi, different companies on there. So it is really awesome to be able to build those relationships. I want to thank you both for being here today, and our audience also for being here. Gary, do you have any last words? If you do, go ahead, and I'm going to then switch it over to my computer and kind of go through some things we have in the upcoming weeks there.
You bet. First, I want to just say thank you to Lisa. Dr. McDonald, you're a joy to collaborate with. It's beautiful to see the evolution of yourself over the last 12 years, and then to be here on this amazing webinar together was a real joy. And thank you for sharing your experience. I really appreciate it and enjoyed every minute.
Thank you for having me. I did as well. You bring so much to my life, and I'm very grateful for you. And Jim, thank you for all you do for my office and my team and my patients. Your help is huge, and it's really making a difference, and I'm grateful for that.
Perfect. Thank you so much.
Yeah, thank you, Jim. And I love this quote that I have up. I don't know if you can see it. It says, though the world does not change with a change in paradigm, the scientist after works in a different world. And what's really powerful about that is now that you know about complete health dentistry, you can't unfry this egg. It's like you see through a new set of eyes, and then it's just a matter of getting it mapped out. And, we've only done 6,000 practices with complete health in it over the years. So, we can help anybody wherever you're starting from to put complete health if you were inspired today by Lisa and what's possible for dentistry and beyond. So thank you so much. I really appreciate the Vatech family, to Brian, Lou, and all the boys on the road, man. Just a big hug to all of you, fist bump. I'm very respectful and honored to be a part of this.
Perfect. Thank you both. Thanks again.
Thank you.
I'm going to go ahead and switch it over to my screen here. And let's go ahead and talk about kind of some things that we have coming up on the Vatech side. We've got next week digital guided surgery, going from patient scan to uploading to a lab, implant concierge, going through converting the case, and then creating the guide, some live 3D printing, so you can be able to see the whole workflow. May 27th, we're going to be going over presenting the case. Paul and I will walk everybody through image capture, data review, and then consultation through the Vatech software there. Here's our implant concierge flyer. Please go ahead and sign up for that. Webinars, you'll be able to find them on our Customer Learning Center. Everyone will be getting a follow-up email that has the link to Next Level Practice and Gary, Kadi, and also to the Vatech webinars. As always, if you need customer support, quick and easy FAQ at the bottom of the screen here with some of the most common questions when you're upgrading or going through the need technical support. And we, Vatech, want to thank you for today and have a safe week, and we look forward to seeing everyone next week. Thanks again.